Welcome back to my channel, and in this video we will be speaking about burning sensation in the mouth. So let's get started. So there are a lot of causes for burning sensation in the mouth, and I'll be discussing the common ones that you come across. So the first very common reason is your fungal infection, that is candidiasis. So it is usually seen in the immunocompromised patients who have had a history of transplant or elderly age group, or patients who've been on long-term corticosteroids. Such patients, you can see oral candidiasis in the mouth, and for diagnosis what you will see that there will be a curdy white or precipitate kind of a lesion in the mouth, and it will be scrapable. That is, when you try to scrape it with the probe, it will come out and it will leave a red erythematous surface after scraping it off. There are various kinds of candidiasis that you see, but this is one of the most common type of candidiasis that you see in the oral cavity. Then coming to the second one, that is lichen planus. So oral lichen planus, in that patient there will be no history as such, and patient will complain of burning sensation in the mouth. You got to look at both the buccal mucosa, you got to check the alveolar mucosa, the gingiva, the tongue, the ventral surface of the tongue, the dorsum of the tongue, and there are 6 varieties of lichen planus, and mostly you see that there can be 2 or 3 variants present in the oral cavity simultaneously. And the most common type of lichen planus that you see is reticular lichen planus, and in that you see white fine radiating striae in the oral cavity, and the patient will complain of burning sensation even on eating normal foods, and also it is more when patient takes spicy food. Then patient can complain of burning sensation. At that time you need to take a history of, there can be xerostomia in the mouth, that is dry mouth. So whenever there's dry mouth, which can be due to several reasons. So dry mouth can be due to like suppose if a cancer patient has been on radiation therapy, during that time there can be salivary gland atrophy due to radiation therapy, and patient can have dry mouth, due to which the patient can experience the symptoms of burning sensation. Moreover, if the patient has been on chemotherapy, or if the patient has been on antidepressants, or if the patient has been on bronchodilators or tricyclic antidepressants or anticholinergic drugs, even then the patient can present with burning sensation in the mouth. Another very important thing is that we need to ask the patient if the patient is also having dryness in the eyes. So that is very important, or the patient feels grittiness or grainy kind of sensation, sand-like sensation in the eye. So that is another history that you need to say, because the patient can also present with Sjogren syndrome. So a variety of immunologic factors or genetic causes that are involved in Sjogren syndrome, and the patient can simultaneously present with any other kind of exocrine disorder as well. So there may be associated rheumatoid arthritis or sarcoidosis. So that history needs to be taken. The patient can present simultaneously with dry eyes, dry mouth. Rheumatoid arthritis may also be present, and we can take a punch biopsy of the minor salivary glands, that is from the lip. It can be taken for diagnosis. Then another reason of xerostomia may be some kind of infection in any of the glands, or which cause any kind of blockage in the saliva that comes in your mouth. So in such cases, suppose if the patient has calculus in one of the salivary duct, that can also cause unilateral swelling of that gland, and also xerostomia can also be present. Then another reason is that patients with diabetes also can present with burning sensation in the mouth, so that history needs to be taken, because it can be either because of poor glycemic control, which can in turn lead to secondary infections like candidiasis, or any kind of bacterial superimposed bacterial infections can also be there. Then there can be peripheral neuropathy, or the salivary glands can also get involved, and because of that there can be reduced salivation, which can in turn lead to burning sensation in the mouth. Then burning sensation we can also see in of viral infections, like suppose if there is any kind of herpes infection which is present, so in those cases, depending upon, suppose in herpes zoster, in the prodrome there can be burning sensation. Suppose if maxillary nerve is involved, then on the palate unilateral burning sensation may be seen on the palate. If the third branch of the trigeminal nerve is involved, that is mandibular nerve is involved, in that the patient can give history of burning sensation in the tongue or in the mandibular gingiva. Then there can be nutritional deficiencies that can be seen in the patients, that also need to be taken. You can advise for a complete blood count of the patient, and you can monitor for any kind of vitamin deficiencies like B12, B6, and such deficiencies can also result in pale tongue. There can be loss of the papilla on the tongue, that is depapillation of tongue may also be present, and there can be dryness of the mouth. And you can check for dryness that in your probe or your dental instruments tend to get stuck to the mucosa when you are checking, or it will tend to get stuck to the tongue when you are checking. That's how you can check for xerostomia in the mouth or dryness in the mouth. So in terms of there can be kinds of nutritional deficiencies which can result in burning sensation. Then if at all we are not able to figure out any kind of causes for burning sensation, there's another very important terminology that is used, that is known as burning mouth syndrome. So burning mouth syndrome, there are a multitude of factors that are involved which can result in burning sensation in burning mouth syndrome, but recently it has been found out that there is impaired brain network dynamics in burning mouth syndrome, and due to which there is decreased inhibitory control on sensory experience, which in turn leads to increased burning sensation in the mouth. Moreover, the treatment that we are giving is slightly different. So we, apart from giving all the multivitamins, zinc supplements, alpha lipoic acid is also given in this case, we are also giving benzodiazepines. We started at the dose of 0.25 mg daily, and then we increase the dosage as per the need. So burning mouth syndrome is basically when we are not unable to reach a particular cause of the diagnosis. Then coming to other causes, miscellaneous causes, we also can ask the patient for the history of ulcerative colitis. So patients with ulcerative colitis can also present with burning sensation in the mouth. Then patients with GERD can also present with burning sensation in the mouth. Then patients with sarcoidosis, which is a granulomatous inflammation which can result in bilateral parotid gland swelling, can also present with burning sensation in the mouth, because there will be xerostomia in such patients. Then we can also take the history of thyroid. So usually in hypothyroid patient there can be salivary gland swelling, which can in turn lead to xerostomia and can result in burning sensation in the mouth. So that brings us to the end of the class. So if you have any doubts and queries, you can leave a message in the comment section below. And thank you so much for watching. Thank you.